Hi, I'm Dr. Arif Kamal, an outpatient palliative care physician and medical oncologist at Duke University. Advanced care planning is really important to me because it makes sure we as healthcare providers know and honor your healthcare wishes. Now, let's get to your questions.
What kind of documents are included in an advanced care plan?
We look at two main documents as part of an advanced care plan. The first is called a healthcare power of attorney document. This document names people, their names, and their contact information who we should look to help make decisions for you if you're not able to make them for yourself. The second is called an advance directive. An advance directive is a written document of your preferences and values based on medical scenarios to make sure the medical team knows how to best take care of you in the future.
Living Will, Advance Directive. It sounds like there are a lot of names. Why are there so many different ones?
There are a lot of names out there, and I wouldn't get bogged down in them. Even as healthcare providers, we hear lots of names, and oftentimes they just have to do with the state that a document is from. Fundamentally, what you want to know is which document is right for me to write down my values and preferences to let my healthcare team know how to best take care of me. And so, specifically for a living will, it's a type of advance directive focused on end of life decisions. But there's also advance directives for a lot of other things, including how you want to be treated from a mental health perspective or organ transplant and other things as well. So at the end of the day, just ask your healthcare provider, what's the best document for me in the state and region that I live in to write down how I want to best be taken care of by my healthcare team?
A healthcare power of attorney helps those I trust legally make some decisions on my behalf. How is that different from a regular power of attorney document?
As it turns out, when we don't have the ability to make our own decisions, there's a lot of potential decisions that can be made. Some of those have to do with finances, like your bills and your house and your mortgage and other things. And some of those decisions have to do with healthcare. We split that up into two buckets. A regular power of attorney is particularly focused on financial matters, whereas a healthcare power of attorney specifically focuses on healthcare decisions when you're not able to make them yourself.
I had a cousin with a serious heart condition, and it was a little bit more serious than an advance directive. Is that common?
It sounds like your cousin had what's called a MOST form, MOST, which stands for Medical Order Scope of Treatment. A MOST form is different from an advance directive or a healthcare power of attorney because it goes into more detail. For example, it asks questions related to IV fluids, nutrition, hydration, and CPR, which advanced directives generally don't go into. What's also different is that a MOST form is put together by you and your clinician, signed by them like a medical order, and you carry it around with you and show it to other doctors and nurses to give them a sense of how you want to be best taken care of if your healthcare condition were to change.
This seems like a lot of documents. Do I need a lawyer for all of this?
So it's a great question. At the end of the day, we want every North Carolina citizen, patients, caregivers, family members, everyone, to think about and complete these advance directive documents. Access to an attorney, although for some patients is a preference, is not necessary at all. Talk with your healthcare provider in a clinic or hospital to get these documents done, and get counsel from an attorney if you think that's important for you.